Hello, dear doctors. Here we are going to explain next question about the cardiology. An 82-year-old male was walking in his garden when he suddenly fell to the ground and was unconscious. He recovered completely within a few minutes. However, he described feeling very hot and flushed after the episode. He remembered the events prior to the fall and confidently says he did not trip. He denies feeling sweaty or dizzy before the fall. What is the single best investigation to diagnose his problem? A. 12-lead ECG. B. Electroencephalogram. C. Capillary blood glucose. D. Computed tomography or heart. And E. Chest X-ray. And according to the sign and symptoms of the patient, we will choose 12-lead ECG to the suspicion to cardiac syncope. The choice will be 12-lead ECG, and we will explain why it's 12-lead ECG. Explanation. Patients who have an unannounced loss of postural tone leading to a period of unconsciousness need to be investigated for three main causes, which are irregular rhythms, low blood pressure or postural drop, and seizures. The first two, irregular rhythms and low blood pressure or postural hypotension, are easy to investigate. However, seizures are a little bit more difficult, and thus we would only suspect if there was any eyewitness who saw the feat. There is usually a period of postictal drowsiness or confusion if a seizure is to be considered. This statement mentions that he recovered completely within a few minutes, which tells us that a seizure is unlikely. Cardiac syncopal events are the most likely cause here, as they are usually abrupt in onset with rapid recovery with flushing. This is the reason that seizure is the answer here. Okay? In many cases, it may be due to a vasovagal syncope, which is a common response to an hour-warm environment or to a period of prolonged standing. It can also occur after visual stimuli, such as seeing blood on the floor. However, patients with vasovagal syncopes would normally feel dizzy and have tunnel vision before a syncopal episode. This is not evident in this stem. Investigations following syncope. Things to do for patients who had a syncopal event and recovered. Find witnesses. See if family members or friends have seen how the patient became unconscious. Was there a seizure? Was there any evidence for seizure or not? Perform an ECG to look for arrhythmias. Perform blood pressure, supine and standing or sitting to look for postural hypotension. Check blood glucose to exclude hypoglycemia. The patients coming with hypoglycemia, they have some other signs and symptoms like cold sweat, shaking, shivering, and after receiving some chocolates or some sweets, they will become easily well, and we can identify hypoglycemia easily. Thank you for your attention.